diagnostic mammogram is a special appointment that is made for patients who have had small abnormalities detected on their screening mammogram. So the diagnostic helps us to be able to distinguish benign lesions from those that could possibly be something that is more serious. We understand that this can be very frightening to patients, and so we make every effort to make sure that they're treated in the best possible and careful way. The patients will come in for additional views and then frequently have an ultrasound examination of that same area so that we can get all that information together and make absolutely certain that what they have is either completely benign or requires additional evaluation. At this appointment, different from the screening, they have a chance to see the radiologist, and we talk to the vast majority of patients that have a diagnostic evaluation. They come into this room and we're able to look at their images on the screen and discuss the entire case, including what the finding was, what we found, and what the ultrasound indicated. So that the patient comes here sometimes anxious, but they always leave comfortable and that they know that they've been well taken care of comprehensively and compassionately. Well, the diagnostic evaluation will determine whether something is a benign finding or whether it requires additional evaluation with a biopsy. Benign findings include anything from a small asymmetric patch of breast tissue to small cysts to benign findings like a fibroadenoma, little small benign tumors that don't require anything. So we go from that to things that are less clear and that would require either additional evaluation, for instance MRI, or even possibly a biopsy. We evaluate all patients from their screening family history forms to see whether they have any increased risk by judging what risks they have in their family and if their family members have had breast or ovarian cancers. We screen these very carefully so that we can help the patient make good decisions. If their risk is sufficiently high to where they may have a gene mutation, the BRCA mutations, then we can actually perform the genetic test here. In addition to that genetic test, we are able to do risk models that are computerized models that we input their data and that will actually give us a lifetime risk. So that way we can know how best to evaluate them, whether with just a screening mammogram, whether screening mammogram with ultrasound, or even as much as MRI if the risk is sufficiently high. Our nurse navigator and a genetic counselor here are able to evaluate and consult with these patients who have high risk. Many patients feel they have a high risk when in fact they don't. So this works both ways. It makes the patients more comfortable when they actually know their risk and they can better plan better tests and ways to avoid breast cancer. There are other factors that can increase your risks of breast cancer apart from family history, and these include consumption of alcohol, cigarettes, obesity, and even dense breast tissue has been known to increase the risk. So all of these factors, when we consider them, give us a better picture of what total risk the patient has. When the patient has a high risk, they actually get placed in a different color folder so that they are evaluated in a more comprehensive and thorough way. So our screening program is very effective in identifying those patients that have normal risk, familial risk, and even genetic risk, which can be very high as 82%. Well, there are a number of myths about mammography and the need for mammography. Among these are breastfeeding. Some ladies feel that if they're breastfed that decreases their chances, or if they have no family history, that decreases their risk. But that's not necessarily true. Breast cancer is so common that the majority of breast cancers occur in women with no risk factors. It is true that if you do have higher risk, your individual risk is higher, but most breast cancers still occur to women with no genetic or positive risk factors. It's actually extremely important to be able to catch the breast cancer at its earliest possible stage. When you have a diagnosis of a stage 1 breast cancer, the treatment and the consequences are completely different than having a breast cancer that has grown much larger or that has spread to different organs. That requires much more serious treatment and can ultimately be fatal.